Good morning, everybody. We'll get started. First off, welcome to ARTA and the ARTA Benefits Plan presentation. My name is Jennifer Hope, and I am the Manager of Marketing and Promotions at ARTA. And today I'm going to talk to you a little bit about ARTA, how to apply to ARTA, the benefit plans available, and allow for some questions either throughout the presentation or at the end. I am recording this session, therefore your video and microphones have been disabled. But if you have any questions throughout the presentation, please use the Q&A function on the Q&A button is located in your Zoom menu. It's the two speech bubbles. So if you have a question, please do not hesitate to ask. So first off, I just wanted to say, some people get a little bit confused that our title is the Alberta Retired Teachers Association. However, we also have a public sector. So that includes nurses, technologists, engineers, Edmonton Police, civil servants. So we are all ARTA. We have an education sector, which is our retired teachers, but we also have our public-private sector, which includes nurses. So just a little bit about ARTA. ARTA was founded in 1963 as a provincial association for retired teachers. However, as mentioned before, we've obviously expanded our offering to include similar groups. So these similar groups hold the same type of insurance risk as a retired teacher would. And these groups have been approved by our Health Benefits Committee and our Board of Directors. So Covenant Health obviously is included within that public sector. We have been the sponsor of our group benefits plan since 1995. We have over 30,000 members and we cover over 46,000 lives. Our provincial office is located in Edmonton. However, we do have a satellite office located in Calgary. So if you are in the Edmonton area, you can always come and visit our head office. You can meet with one of our member services team members and you can sit down with them and kind of talk about a plan that works best for you. Or if you're in the Calgary office, you can also come in and meet with our member services team members. However, if you're not within those areas, you can always schedule a virtual meeting with one of our team members. So if you visit arta.net, you can schedule a virtual meeting and sit down with them and kind of talk about which plan works best for you and your family. So there is a fee to becoming an ARTA member. For our public sector members, it is $50 a year. And if you are getting benefits, that is $4.17 added onto your monthly premiums. But with that ARTA membership, you are gaining access to the ARTA benefit plans, but you also are able to take part in some of our really great membership advantages. Wellness is one of our strategic goals. Therefore, we encourage that our members support a healthy, happy, and active and engaged lifestyle in retirement. And we promote this to our members by offering a variety of wellness initiatives throughout the year. We have a photo contest where members can submit their photos and receive some really great prizes. We have a writing contest, so maybe writing is more of your forte. So we have different categories where members can submit their writings to and get some great prizes. And we also have a wellness initiative throughout the year where members can get together and walk together and encourage staying active in retirement. We also have a really great member discount program. We recently brought our discount program in-house and we contacted hundreds of businesses, asked if they would be willing to offer our members some discounts. And we have well over 100 partners who offer our members discounts. So different restaurants, hotels, retail outlets, just a few different logos here that are recognizable. So if you use your ARTA Perks member discount program once or twice, your membership would have paid for itself. We also have a really great scholarship program that's available for our members' family members. So we award 8 scholarships to our members' direct relatives, so children, grandchildren, nieces, or nephews. who are attending post-secondary education, whether it's a diploma or a degree program. They can submit their application to our scholarship program and possibly be one of the recipients of one of 8 $5,000 scholarships. So this is ARTA's way of promoting post-secondary education to our members, children. So applying to ARTA is easy. You know, if you're thinking about retiring now, and you've decided that you are going to retire, you need to start thinking about your retirement health benefits. So, you know, you do a little bit of research, figure out which plan is best for you and your family. And if you decide to choose ARTA, that's great. Or maybe your spouse is continuing to work. And if your spouse is continuing to work and you can be a dependent on their benefits plan, you can remain a dependent and stay with them. However, once your spouse decides to retire and you decide to join ARTA, it's really important to apply within a 60-day window of losing your or your spouse's group benefits. Because if you would like to join ARTA and one of our plans that includes emergency travel insurance, and you apply outside of the 60-day window of losing your employer-sponsored benefits, you would need to fill out a medical questionnaire. So it's always just best to apply early. I typically say if you know you want to join ARTA, you know you want to join one of the ARTA benefits plans, get your application in 4 to 6 weeks before you're going to lose those benefits. So you don't have to worry about it. It's an easy thing to do, but it is important to apply within 60 days of losing your employer-sponsored benefits. So now I'm going to go right into our benefit plan. So a bit of a background of the ARTA Benefits Plan. Our group plan was established in 1995 by a group of retired teachers who wanted to create a benefits plan that was more conducive to retirees' lifestyle. We all know retirees love to travel. You're no longer bounded by your vacation time. You can travel whenever you want. You don't need to be here for those busy times when you're working. You can take advantage of all of those low season prices and just go last minute. So ARTA offers some really unique, really great emergency travel coverage. We don't have any stability or pre-existing condition clauses built into our emergency travel coverage, and that's very unique compared to other plans in the marketplace. And I will talk about our emergency travel coverage in a little bit here. We're a not-for-profit organization, so any dollar that comes into ARTA goes back to paying claims, back to administrating the plan, and ensuring that we're offering our members the best benefits possible. There are some plans out there that will offer you a discount of say 10 to 15% if you join at a certain time. We don't offer a discount to our members because we don't have those profit margins built into our premiums as we are a not-for-profit organization. So there are some eligibility requirements that you need to meet before becoming an ARTA member. So if you are vested to receive a pension plan, so LAPP, or if you have been if you have been part of the United Nurses of Alberta for 2 or more years, you can join ARTA. There's no age restrictions to joining ARTA. You can be any age, and we also don't have any termination ages. So you can stay on an ARTA benefits plan as long as you want. Different plans out there will terminate you at the age of 85. I know I hope that I'm traveling well into my 80s, so you can join ARTA at any age and you can stay on with ARTA until any age. You need to be an ARTA member, so you need to pay that $50 a year, but again, you receive those really great membership advantages. You need to be a Canadian resident covered by your provincial or territorial health insurance plan within your province of residence. And we have members throughout the country. If you decide to retire in Alberta, but you want to get away from our cold winters and live in BC, you can move to BC. Or maybe you have family on the East Coast, and you can move to the East Coast and your ARTA benefits will follow you there. The only province where the ARTA benefits plan is not eligible is in Quebec, as their provincial healthcare plan does not work in tandem with our plan. Your eligible dependents are able to join on as your dependent on the ARTA benefit plans, as well as your surviving spouse. So if you're eligible to join ARTA today and something were to happen to you, your surviving spouse can join an ARTA benefits plan. Also, if you do join ARTA as the primary card holder and you do have a dependent, a spouse or a child, that dependent can continue on with their ARTA benefit. So your surviving spouse is able to stay onto ARTA if something were to happen to you. So now I'm going to talk about the different plans that are available to you. So we have two different umbrellas. We have our comprehensive plans. Our comprehensive plans are available to members who are under the age of 65. We know that not everybody retires at the age of 65. Some of us are lucky enough to retire at the age of 50. But however, if you are under the age of 65, you're not eligible to join the Alberta Coverage for Seniors plan yet. And the Alberta Coverage for Seniors plan, when you do turn 65, that plan becomes the first payer of prescription drugs, and then your benefits plan becomes the second payer in prescription drugs. And the Alberta Coverage for Seniors plan pays 70% of prescription drugs, and you're responsible for a 30% copayment up to $25 out of pocket. But if you are under 65, you might need some higher prescription drug maximums. So our comprehensive plans do offer this. And it also offers a little care for a little bit of everything. And the build your own plans allow for a little bit of customization with some lower prescription drug maximums, as these plans were built to work directly in tandem with that Alberta Coverage for Seniors plan. But first, I'm going to go into our comprehensive plans for members under the age of 65. So these plans have a little bit of everything: extended healthcare, emergency travel coverage, and dental. We have three different levels of coverage in these plans, core health being the most basic, and enhanced health being the plan that has some higher maximums, and essential health being that middle of the road. All of the annual maximums are per covered person. So if you have a spouse on your plan, those annual maximums are available for both of you each. All of our plans include single, couple, and family care coverage, and you're always able to move up in coverage. But once you've moved up in coverage, you are locked in for 24 months. So you can always start with core health, but maybe after 2 years being on core health, you're reaching your annual maximums, and you need a little bit more coverage for prescription drugs or paramedical services, you can always move up. But once you've moved up, you are locked in for that 24 months. So I'm going to just highlight a couple items that are available to you in our comprehensive plans, but I just want to note that we offer a very long list of different benefits. These are just some popular items that people do look at when they're looking at a health benefits plan. So the overall coverage level within our comprehensive is 100% unless otherwise indicated, meaning if you submit a claim, you will be paid out at 100% unless it's one of those items that is at 80%. The overall annual maximum ranges from $10,000 to $15,000. So with all of the claims that you submit throughout a year, we'll pay up to that annual maximum. Prescription drugs, they are covered at 80%, ranging from $1,500 a year all the way up to $5,000 a year. I know some of you might not know how much money you have been spending on prescription drugs throughout the year. So typically I suggest that people maybe go to your pharmacist, ask them for an annual average for maybe the past 2 to 3 years of what you've been spending on prescription drugs. And then you can make an educated guess on how much annual maximum you do need for prescription drug coverage. Paramedical services is covered at 80%, and this is an annual combined maximum. So what this means is, so paramedical services are those practitioners that offer coverage for massage, chiro, physio, occupational therapy. ARTA covers a list of 12 different practitioners. So this is an annual combined maximum, meaning you can spread out that maximum throughout the year. So maybe you are somebody who threw out their back and you need to spend $1,000 on massage. You can do that, but just know that you don't have annual maximum left over for those other practitioners. So maybe you want to spend $500 a year on massage. Maybe you want to spend $500 a year on counseling. That's entirely up to you. We want our members to be able to use that annual maximum on the practitioners that they need. Different plans will offer you $400 for massage, $400 for chiro, $400 for counseling, but you might not use all of those practitioners. We've done a little bit of research with our members, and typically people only use 1.8 of those 12 practitioners. Diabetic supplies are a separate line item in the ARTA Benefits Plan, so our insulin-dependent diabetics receive $1,750 a year. And also with our comprehensive plans, you are receiving our 92-day emergency travel coverage with no stability or pre-existing condition clauses built into those plans. And you're also eligible for our supplemental travel coverage. And again, I will go into that a little bit further when I talk about emergency travel coverage. Our comprehensive plans also include dental care coverage. So under our comprehensive plans, you receive 80% coverage for basic, preventative, and minor restorative work. And our enhanced health plan offers 50% coverage for major restorative work, as well as 50% coverage for orthodontic work for any eligible dependents that are at home with you. So maybe you still have an eligible dependent that requires some orthodontic work. Enhanced health might be the best plan for you. So now I'm going to talk about our build your own plan. So again, our build your own plans were built to work directly in tandem with the Alberta Coverage for Seniors plan. When that plan is the first payer in prescription drugs, and then ARTA becomes the second payer in prescription drugs. So our build your own plans do allow our members to build some customization into their plans. So you need to, on the topic of prescription drugs, within our 4 build your own plans, you do need to choose an annual prescription drug maximum of either $1,200 or $2,000. So maybe you're someone that doesn't need a lot of prescription drugs and that $1,200 is sufficient for you. That's great. But maybe you do need that $2,000 annual maximum. You can also go with that. And again, you're always able to move up in coverage, but once you've moved up in coverage, you are locked in for 24 months. So with our build your own plans, you're also able to choose whether you would like emergency travel coverage or not. So we offer 2 plans that do not include emergency travel coverage, HealthWise and HealthWise Plus, and 2 plans that do offer 92-day emergency travel coverage, Total Health and Ultimate Health. HealthWise Plus and Ultimate Health, those 2 plans have some higher annual maximums for paramedical services, hearing aids, vision care, as well as some coverage for defined lifestyle medications. But if you're not going to use all that annual maximums, maybe start at Total Health or HealthWise, and maybe if you do need that later, you can always move up in coverage. But once you've moved up, you are locked in for that 24 months. So again, with our build your own plans, we offer a long list of different benefits that are covered. Just a few are highlighted here. So again, prescription drugs, you need to choose that annual maximum of $12,000 or $2,000. Diabetic supplies, a different line item. Vision care is covered, so $425 up to $555 every consecutive 24 months. Also, all of our benefit plans include coverage for a long list of different medical aids and supplies. So the Shingrix vaccine, wheelchairs, scooters, compression stockings, power lift chairs. So we know that our members are with us for a very long time. So as you age, you may require coverage for different medical aids and supplies. Also, with all of our benefit plans, we offer some really great additional resources. Green Shield Health offers some really great virtual services. We have a virtual physician service where you can pick up the phone and speak to a licensed practitioner, talk to them about what's going on with you, and they can help prescribe medications to you and let you know what your next steps are. We all know how hard it is to get into a doctor, especially if you're in one of the rural communities. So this is a really great way to be able to talk to a doctor and figure out what next steps and get a prescription. We also have a really great members assistance program where our members receive 5 hours of free counseling, as well as 3 hours of couples counseling to kind of talk about different mental health issues. So that's a really great benefit. We also offer ARTA Cares, which is a really great tool to help navigate our members through the healthcare system. So now I'm going to talk about our emergency travel coverage. If you're taking part in one of our plans that offer our emergency travel coverage, so one of our comprehensive plans, Total Health or Ultimate Health, you're receiving access to some of the best emergency travel coverage we have in the country. You have competitive in the country because we don't have any of those stability or pre-existing condition clauses. So if you have a prior health condition or maybe you have a change in medication and you want to go on your trip and there's no cause for concern, both you and your doctor feel that you're well enough to go away because of a prior health condition, that's great. You can go on your trip, and if something were to happen to you, you would be covered for that. You're not required to be stable for a certain time period. A lot of plans require that if you have a prior health condition, if you have a change in medication, any change in your health, you are required to be stable for 90 days. But with ARTA, that is not a requirement. Any medical emergency just needs to be considered sudden and unforeseen. And if something were to happen to you while you are away, you are covered for 100% of those eligible expenses up to a $5 million lifetime maximum. Nobody's ever come close to that $5 million lifetime maximum. I think the highest claim that has ever came in, it was just under $800,000. Somebody did suffer a heart attack in the States and needed surgery. And of course, when you're in the States, those bills add up, and they were covered for that because they had ARTA emergency travel coverage. So you are covered for any 92-day trips you take outside of your province of residence. But we know a lot of our members like to snowbird in places like Palm Springs or Phoenix, or maybe you're taking a trip around the world because you have the time to do that. And your trip could be longer than 92 days. We do offer supplemental travel coverage in 15-day increments all the way up to 212 days. And it's always better to have that supplemental travel coverage before you go away. However, if you are on day 90 and you have not made a claim on your emergency travel coverage and you're on a beach in Mexico and you see that it's minus 40 in Edmonton, you can call ARTA and add those 15-day increments. And any unused 15-day increments that you do not use, you will be reimbursed for that. Also, that's really unique with the ARTA emergency travel coverage is we offer trip cancellation and interruption insurance. So every covered member and every incident, you are covered for $10,000. So maybe you need to cancel your trip because you fall ill or your travel partner falls ill. Maybe your home suffers a flood or a fire and you can't travel anymore. You're covered for $10,000 per incident per person. So when you are comparing different plans, make sure you are looking at that those pre-existing condition clauses, those stability clauses, whether or not that plan has trip cancellation or interruption insurance, as well as those termination ages. A lot of emergency travel coverage plans will terminate you at the age of 85. So within our build your own plans, dental is not included. So our build your own plans do offer 3 standalone dental care plans, option A, B, and C. Option A being the most comprehensive of the 3, which offers 80% coverage for basic, preventative, and minor restorative work. And option A offers 50% coverage for major restorative work. So those crowns, implants, onlays, all that nasty dental stuff. And option C is the most basic, offering 65% coverage for basic, preventative, and minor restorative work. You're not required to take a dental care plan. You don't have to. You can add it when you join ARTA. A lot of people do. Or you can add it later on down the road. It's entirely up to you. And our dental care plans offer single, couple, and family care coverage. And you are able to move up in coverage in our dental as well, but once you've moved up in coverage, you are locked in for 24 months. So we all know it is, confusing to choose a benefits plan. Our employer typically has taken care of us throughout our careers. However, now that you are thinking about retirement, you do need to maybe think about a retiree benefits plan. So if you go to artabenefits.net and you click on the Build Your Benefits plan, This tool will help you choose for you. It will ask you if you're over 65, under 65, whether you want travel, whether you don't want travel, whether you want dental. And from the questions that you answered, a chart will populate with all of the plans that are available to you, as well as the rates associated with that plan. And then if you do choose an ARTA Benefits plan, you can apply online here. And on artabenefits.net, this is where you can find all of the rates. So if you scroll to the footer of the page and click on benefit booklets, that link will take you to a page that has our plan options brochure, which outlines all of the different benefits plans and what they offer. And then also, if you click on the rate sheet, public-private sector, that's the rate that Covenant Health employees should look at. And then that will show all the rates associated with all of our plans. So visit artabenefits.net, and this website has a wealth of information. So that's kind of all I have for you today. However, if you would like me to send you an enrollment kit, please email join@arta.net and we can mail one out to you. And in this enrollment kit, it offers a plan options brochure, a rate sheet, different booklets talking about ARTA, a guide to retirement. So we can mail one out to you. So just email join@arta.net and we'll get one out to you today or tomorrow. Or we can email you information as well. If you have any questions, I'm happy to answer them. So email join@arta.net, or you can email info@arta.net and our member services team members can help you out as well. So that's all I had for you today. However, I will stick around to answer any questions that come up in the Q&A box. If you don't have any questions, thank you very much for joining us today. This presentation will also be posted on our YouTube channel. So if you visit YouTube and search the ARTA channel, you can view this presentation in the future as well. I also have a presentation again at 3 o'clock today, so if you want to hear me talk again, you're more than welcome to join. But again, if you have any questions, I will stick around and answer them that come up in the Q&A box. There is a question, if you add in a dental plan later, is there a waiting period before you can make claims? No. However, if you are outside of your 60-day window of losing your benefits, your dental plan, those annual maximums are just prorated to January. But you can join the dental plan and you can make claims for basic, preventative, and minor restorative work. But if you join in June and you're outside of that 60-day window, those annual maximums are just prorated to January, but there is not a waiting period. So I don't see any other questions coming into the Q&A chat. Again, thank you for joining me today. And if you have any questions, please email join@arta.net.